Okay, so you're 22, and you've already been taking great care of your skin. You're really aware of preventing aging changes already, right?
Yes, yeah. So I've been seeing Chelsea for facials pretty regularly, about once a month. I was suffering with some pretty severe acne, and she's kind of helped me get that under control. She's gotten me on a really good skincare regimen, so I'm using the retinol, and I've kind of talked to her a little bit about working on the fine lines that I have in my forehead. She said the retinol will help, but of course talking to you about doing something as far as the collagen and things like that go would be a good idea. So here today just to kind of work on that.
It's great. So being on a retinoid, which is what you're on for acne,
Yes.
also is anti-aging, which is a great side benefit. So most dermatologists will tell you that anyone who's not pregnant or nursing should be on a retinoid containing product lifelong, actually, because as you age you're going to start to lose collagen, and we want to keep the collagen building to sort of counteract that. So the retinoid, using that even every other night to every night depending, is great. You're already doing that. You would only need to stop that if you were pregnant or nursing, other than you would want to go right back on.
Okay.
So long term. And then there's some other things you can do in the office to help build collagen, including microneedling, which is a really minimally invasive procedure that you just come in and we take a tiny little device and use it across your skin. You're pink for like that evening, and that also helps build collagen. Also the clear and brilliant laser is a similar type of device. So those are some things we can talk more about too, to just keep stimulating our collagen, maybe even every 3 months, like 4 times a year is a great plan. But for today, I know that the forehead lines are what's bothering you. And if you had no lines at rest at all, I would say it's not time yet. But because if we look in the mirror together, we can see you're starting to get these lines even when you're not making facial expressions. And some people will get the line, down the middle from frowning first, and it's just genetic, really, just the predisposition.
Very expressive, so.
Which is great, and we don't want to, we still want you to be expressive, so that's why it has to be really natural looking.
Right.
But on the other hand, if we can start to relax the muscles in your forehead that are causing those lines, we can really prevent you from getting the deeper creases. And of course, they're harder to get rid of once they're there more permanently. So we can do what we call sort of a baby Botox treatment, where we just do very light treatment across your forehead here, so it shouldn't affect your brow position, and you should still be able to raise your eyebrows and make expressions, just not have the lines forming. And starting early on that is just really great because of the fact that it is preventative.
Yeah, I'm excited.
So we can
That's
definitely do that
perfect.
today.
Thank you.
Yeah, my pleasure. Okay, so this is really an example, kind of similar to what you have going on. Just the lines starting just barely, and when she's not making an expression, and then here's the after photo. Usually if you come in about a week to take a look and make sure it's all perfect, but that's a really typical example of how it will look.
Beautiful.
It's gonna be great.
Yeah.
Those great brows.
Thank you.
And that's it. That
Oh
easy.
my gosh, that was so easy.
Quick and easy.